My name is Michael Cavanaugh. I'm with the Amalgamated Clothing and Textile Workers Union here in Biddeford and around the state of Maine. I'm here tonight with two guests, Representative Charnene Rydell of Brunswick and Joe Ditre of the Consumers for Affordable Health Care Coalition. And we're here talking about health care reform, in particular health care reform efforts in the state of Maine. By way of brief introduction, my role has been, for the last couple of years, chairing the Maine AFL-CIO Committee on Healthcare Issues, and in that capacity have had the opportunity to work with both Charnene and Joe and others in Maine on efforts that we have made and continue to make healthcare accessible and affordable and available to all Maine citizens. There is, at the moment, a great deal of discussion in the country about national health care reform, as the President and Mrs. Clinton have made health care reform and the effort of a task force a primary focus of their administration. And we'll talk about that issue, but we want to also talk about efforts that have gone on at the state level, and particularly efforts that are currently heading to the legislature in this session. But as way of introduction, I thought it most appropriate that we might start by talking about what has happened here in Maine over the last few years to try to make health care accessible, and to talk a bit about the efforts of the Consumers for Affordable Health Care Coalition. Joe Ditre is the staff director of the Consumers for Affordable Health Care Coalition and has directed efforts for some 3-4 years now.
5 now.
5 years with the coalition, and we're going to talk with Joe about that. Charnene Rydell has been an active participant in that coalition as a state legislator. We're very fortunate to have Charnene because Charnene has not just provided leadership here in the state level, but also has become a very influential and important member of the National Conference of State Legislatures at a national level, and as well the National Academy for State Health Policy, and has in fact spent time and continues to spend time in various places in the country bringing attention to how state legislatures can deal with healthcare reform efforts in their own state. And together we've had experience working here in Maine and will continue to do so. Let me start, Joe, with you, if you might, and could you describe a little bit about the genesis of the Consumers for Affordable Health Care Coalition and what's going on there?
Yeah, briefly, the Consumers for Affordable Health Care Coalition is an organization of other organizations, and in particular there are consumer organizations, there are labor organizations, there are small businesses, there are healthcare providers, primary care doctors and family doctors, there are nurses, there are mental health workers, and then there's a broad range of array of churches that are also part of the coalition. There are now 75 organizations that are part of this coalition, and we're all working towards the goal of universal, affordable, quality health care for every Maine citizen. That has been our goal since 1988, and we started out with a program, working for a program that Representative Rydell headed a task force to develop called the Maine Health Program. That program now covers about 8,400 adults and children in the state of Maine. It keeps our health insurance costs down because it stops cost shifting, and provides those 8,400 enrollees with comprehensive health insurance coverage and primary care. After that, we began working on reform efforts that would help citizens who had health insurance coverage to maintain and continue their health insurance coverage, especially when they changed jobs or when their employer changed coverage and those particular individuals had pre-existing conditions. And that law was a first-in-the-nation law that is called our Continuity of Health Coverage Law, and it was passed in 1990, and it basically provides those protections to workers who change their jobs, have pre-existing conditions, or where their employers change coverage, and we're trying to expand that law. In fact, there's some reform efforts in the state now, and I'll let Representative Rydell speak a little bit about those.
Mm-hmm.
That was a tremendous victory for consumers in the state of Maine, as well as businesses who constantly had to go through this process of dealing with insurance companies and and insurance companies saying we'll accept these number of workers, but we're not going to accept those ones who are sick and need health insurance. And so that was a tremendous first effort, and to reform the health insurance system. We followed that up with a law to require small group insurers to community rate their products, which keeps the product and the policies affordable for those who are older and those who are sicker within various groups, as well as provide coverage to the younger people. So those are some tremendous reform efforts that we've worked with legislators like Charnene Rydell to get passed.
And Charlene, if you could just talk to us for a minute. I know we are gonna focus on where we're at right now, and you have a very important piece of legislation that you're co-sponsoring. But you've been there, and you've been on the front lines of this battle of the legislature from the beginning. And I wonder if you might comment a little bit about how you saw the development of healthcare reform efforts in Maine to bring us to the point we're at now.
Well, first, I'd like to say that I entered the legislature with healthcare issues as my prime interest. I had worked for many years, particularly with families that have children with very severe developmental disabilities, and it was through that kind of work that I saw the need for some drastic changes in our healthcare system, and in particular in our healthcare coverage, because these were families that clearly needed healthcare coverage, that needed a healthcare coverage that was comprehensive and affordable, and that would last through a lifetime for their child, and not be subject to pre-existing condition exclusions when one changed jobs, not be subject to incredible increases in cost and of premiums because they happen to have a person who actually needed to use the insurance. One of the problems that we have seen in the last 2 decades in our country has been the withdrawal of health insurers really from the insurance business. They have not wanted to accept risk. They have tried to limit the kinds of persons that they would insure to be the most healthy persons, and to charge those persons who were not so healthy or who were older and sicker much higher premiums. So we've seen a tremendous cost shift from towards those people who have the most severe illnesses and hence have the most drastic health care needs. In this state, we have really had, I would say, a step forward. We've been a step ahead of much of the rest of the country. Going back to the early 1980s when we passed hospital regulation in this state against some very strong opposition from some hospitals. However, we did put in place the Maine Healthcare Finance Commission that does regulate hospitals, that does ensure that all persons in this state, regardless of income, are entitled to hospital care, and that persons whose incomes are below the poverty level are entitled to that care free of charge if they're unable to pay for it. And with that, we also recognized that while we were making an effort to keep down hospital costs and to regulate the high technology in our state that would be purchased by hospitals, we recognized the need to move ahead with, as Joe says, increasing coverage for people in a comprehensive fashion. And we established the Access to Healthcare Commission in 1987. And we invited businesses, we invited providers, consumers, legislators, anyone who was interested in the healthcare issue to sit down with us and to really hammer out that issue with respect to what kinds of programs were most suitable for our state and how could we best pay for those programs. Out of that came what we refer to as the Maine Health Program. And it does include, as Joe explained, an insurance plan for low-income people, for children up to 125% of the federal poverty level for family income, and adults 100%. There's unlimited enrollment for children across the state. So children who are living in families with low income who are not eligible for Medicaid can apply for this program, and the program has an open enrollment policy. We have limited enrollment for adults, but we are very fortunate that we're one of 3 states that has federal matching grants for that.
Charlene, can I just interrupt you to ask about that, the Maine Health Program? I think it's important for our viewers to know that this was a program that, as I recall, was passed at the time with rather broad support, was it not? I mean, this wasn't something that had a large coalition of groups and organizations behind it?
It was, and Joe and I spent many long days in the State House, hammering out the details of this plan with representatives of the administration.
That's the McKernan administration.
Yes, and
For those of you who may have forgotten.
and provider groups and consumers. And we passed that legislation on July 1st, 1989, and in that legislation was included a considerable revenue package, tax increases, cigarette taxes, alcohol taxes, and some other small sales tax increases, or actually an elimination of some exemptions, to pay for this program. In fact, to more than pay for this program. And in the House, it passed with no dissent and absolutely no debate and no dissenting votes. And in the Senate, as I recall, there was one dissenting vote, but it passed overwhelmingly, was signed into law by the governor, and included, in addition to the insurance program, included an increase in fees paid to physicians under this program and the Medicaid program. It included a primary care and prevention initiative through community health grants to small hospitals and rural health centers. And it also included expansions under the federal Medicaid program to take advantage of federal funds whenever we could. It was a tremendous effort, and I think it really paved the way for our future efforts.
Do I recall correctly that when the Maine Health Program first came online, that the system was swamped with applicants? I don't know what the projections were in terms of how many Maine citizens were in need of such a program or would take advantage of it, but am I correct that there was an overwhelming number of people who stepped forward into this program?
Absolutely. This was a very proud moment for us as a state and for all of us who were involved in this effort. And I remember that the Special Access Commission's report indicated there was about 119,000 Mainers at that time in 1989 who were totally uninsured, even though 75% of the adults were working full-time jobs. And that figure still remains, that we have now 136,000 Mainers who are uninsured. 2/3 of them are children. Of the adults, 75% are still working full-time jobs. But even though this had the income level is, as Charlene indicated, up to 100% for the adults and 125% for the children, they were overwhelmed with applications, and people didn't realize the pent-up need for health insurance that was out there. It's tremendous.
It may be an oversimplification to say, but I think it's probably accurate that in part the overwhelming response to the Maine Health Program helped to push. I mean, there's been many things that have pushed this issue of healthcare reform to the forefront, and it seemed to me the fact that program, which was a remarkable and still is, I mean, fortunately because of the efforts of Charlene and others to save the program from the budget acts, the Maine Health Program does still exist. But the fact that that's been overwhelmed and the demand, as Joe suggests, is so great for health insurance that has helped to advance this issue to now where we're talking about something much more comprehensive, and we are going to do that in a second in terms of what your bill is. But I interrupted you, Charlene. I know you're sort of discussing how we got how the legislature got to the point of where we are today with the various reform pieces that have been passed, and I wonder if you might sort of carry on that thread now as to where the legislature then went after the passage of the Maine Health Program.
Well, as Joe said earlier, we moved on to then dealing with the problems for those people who did have insurance through their employers and who had been subject to pre-existing condition exclusions, waiting periods, who were denied coverage when they changed jobs, or who found themselves left out when their employer changed carriers. And that was why we moved into the continuity of coverage bill. And we actually passed a bill that was very strong. We were able to resist the insurance industry that wanted a very different kind of bill, and one which would not have nearly so many consumer protections. We were not able to include the persons who are covered under individual coverage, persons who purchase their own insurance or who may actually receive a little assistance from an employer towards that purchase, but who do not have access to group coverage. And that is still on the table now. And in fact, that and strengthening our community rating bill, which we passed last year, and which will end the use of health status as a factor in insurance rating as of this July, and will guarantee a renewal and guarantee the issue of small group policies. That community rating bill, which over a period of several years will phase out all kinds of rating differentials for age and gender, we need to also offer those protections to persons in the individual market. Many people, and I'm sure many of the viewers, either themselves or know people who do not have access to group coverage through their employer and who are trying to keep themselves and their families covered by purchasing an individual policy. And the problem with those policies, particularly in commercial carriers, is that their rates are regulated by the Bureau of Insurance, but their rating practices can be very horrendous. And in fact, they are taking in many cases, many more dollars than they are giving out and paying out in actual claims. And we feel the need to offer those people protection from the abuses in that market. So we moved on to submitting a bill last year that would have created a committee to study the feasibility of a statewide health insurance plan. That bill was passed by the legislature, and I was one of the sponsors of that bill. It was passed by both houses, and it lay on the governor's desk until he decided that he would not sign that bill. When it became apparent that he was going to veto that bill, several of us went to the Legislative Council. And the Legislative Council is composed of all the leaders of both parties in both the House and the Senate. And we requested that the Legislative Council allocate a small amount of money so that a group of legislators, the Banking and Insurance Committee with some additional members, could over the summer and fall actually conduct a study to work with labor, business, consumers, providers, advocacy groups, groups representing disabled people, elderly people, and come forward with the proposals for the next steps for Maine. How do we strengthen what we have, and how do we move on to a universal program that will be affordable and comprehensive for all of our citizens? The Joint Select Committee, as we came to be called, concluded its work in late fall and published a report and legislation. And that legislation has a number of very important pieces, all of which could be implemented if the legislation is passed quite quickly. Strengthening the continuity of coverage bill, strengthening our statutes with respect to protection for people who purchase individual policies, extending our regulation of hospitals to ambulatory care facilities and even physician offices if they are going to get involved in very expensive, high technology. We had a bill last year that was also vetoed by the governor that would have regulated the purchase of high technology items costing over $1 million.
MRIs and
That's right. We have more MRIs in the state of Maine than they do in all of Canada. And while the Canadian number may not be right, the Maine number is not right either. And we certainly do not need any further machines purchased, particularly when on the horizon are several other pieces of technology that may in some cases replace that one. But we feel that one cannot regulate part of the market for that technology. One has to regulate the entire market. And also more and more of procedures are moving out of the hospital, and not just to the outpatient department of the hospital, but actually to ambulatory care centers and even to physicians' offices. And we need to know what is happening and how it is happening around our state. So we also are proposing to strengthen the data collection and information collection part of our system. We're proposing to also encourage the movement towards a statewide health insurance plan, but we did not in that bill actually propose a plan, and that was because the Joint Select Committee could not reach consensus on that, and the decision was made to put forth a bill that really was a consensus bill.
Okay, and Joe, let's talk about that for a little bit, because we know the Consumers for Affordable Healthcare Coalition was certainly very involved in integrally in all of what Charlene has talked about on the legislative front. The coalition provided, I would think it's be safe to say, a lot of the troops, a lot of the groundswell of support, the organized support to move in this direction. I wonder if you could comment a little bit about the role that citizens through this coalition played in this advancement.
From the very beginning, with the Maine Health Program and the pre-existing condition law, the reason that we have made such tremendous strides is the citizen involvement. Maine is we're very fortunate here in the state of Maine that people are willing to get on the phone and call their legislators and say, I like this, but I don't like that, and this is my opinion. I think that we are the first state in the nation to defeat the health insurance industry in terms of their horrible and horrendous practice of denying coverage to people who need care simply because of consumer involvement. And I work with the Maine People's Alliance. We organize citizens and communities all throughout Maine, and I think that that element of consumer involvement, that consumers are not intimidated by the quote-unquote experts, and are willing to say, I understand this, I know what's going on, and I can make a difference and call in to legislators like Charlene and others and say, I really like what you're doing, I think this is the right way to go, and, and I want you to support this bill. That's a tremendous, that has always been the reason why we were the second state in the nation to pass community rating. Again, another big blow for the insurance industry. The guys that come to these hearings from all over the country with blue suits and ties and their briefcases and saying the citizens of Maine don't need these changes, as if they know. They're coming from Chicago, Illinois, Washington, Boston, Philadelphia. And so that's where it's very important that your listeners understand that their involvement is absolutely critical. You are all experts. You all understand this. And the only thing I could say is get involved. Call us. We're at 622-4761. You'll reach me in Augusta, or in Portland you can call 761-4400 to the Maine People's Alliance and get involved. You do make a difference.
Well, I think it's just make interject here for anyone who may have tuned in late. I'm Mike Cavanaugh with the Amalgamated Clothing and Textile Workers Union. I'm with Representative Charnene Rydell of Brunswick and Joe Ditre of the Consumers for Affordable Healthcare Coalition, and we've been talking about healthcare reform efforts, particularly in the state of Maine. We are been talking for the last 15 minutes or so about the development of the effort in Maine, both through the efforts of legislation and particularly, as Joe was just saying, through the efforts of citizens organized through the coalition, union members from our unions, community groups, citizens from all walks of life who've increasingly said we need major change, radical surgery in our healthcare system. And we have now gotten to the point in Maine where, and as a nation, where we're poised on the brink of some type of national healthcare reform legislation. And I'd like to see if we could spend a few minutes talking a bit about that, because lots of people are familiar now with the fact that there is a reform bill that the administration will be putting forward, the Clinton administration will be putting forward in early May. And there's a lot of controversy about what that might look like and what impact that might have on efforts we have here in the state of Maine. And let me just throw it open to whoever would like to take that first. What do you see developing? What do you hear is happening there? What do you think about it?
Well, I think as we've heard and read, there's there are some new buzzwords out of Washington, and a couple of them are managed competition. And what seems to have caught the Clinton administration and, frankly, a number of states and health policy people around the country is the idea that we should create health insurance purchasing corporations. And those would be entities that would, in effect, purchase health insurance on a competitive bid basis from managed care companies. And those are health maintenance organizations, what we call HMOs, or preferred provider organizations. We call those PPOs. And that individuals and businesses would choose their coverage through one of these entities that had a contract with the Health Insurance Purchasing Corporation in their region. Now, that has been developed quite extensively in California. The insurance commissioner there has put out a plan which he had thought would be for California, and he has now taken that plan to Washington and is working very closely with the Hillary Rodham Clinton task force. And also an economist out of California, out of Stanford, Alan Enthoven, was part of a group that has come to be known as the Jackson Hole Group, because they retreated to that lovely ski resort in order to do their planning. And they have developed a managed competition model for the country. The problem is, and I have actually been at seminars with Dr. Enthoven and with the people from California out of the Insurance Commissioner's Office, and they admit that one needs to have a certain population base in order to make this successful. And as we know here in Maine, while we may be able to choose amongst several different providers in Biddeford or Portland or Brunswick or Augusta, when one strays not too far from our cities and our larger towns, one finds that there are very few providers. And in some cases, there may be only one provider. And in some areas, we frankly have a tremendous shortage of providers, particularly in our more rural areas. And certainly, we have a tremendous difficulty with access to appropriate providers from most of the population of Maine. So what we have been doing, some of us from Maine and from some other rural states, we have been trying to bring a different perspective to the task force, and to have them understand that the rural states need to be able to develop plans that will be appropriate and that will be able to be implemented within the context of the number of providers that we have, the income abilities of our population, and the cultural aspects also. Because while HMOs are prolific in Minneapolis, Minnesota, or in California through the Kaiser companies, in Maine we only have 2 HMOs. And in many parts of our state we still have people who really have little, if any, understanding of an HMO and certainly no experience with it. So we've been trying to develop what we think will be an appropriate plan for Maine, and to use our influence to try to get some of that into the planning at the national level.
Okay, well, we want to talk about what influence we may have, because this show, as Joe says, is not just about information, it's also about organization, and it's no secret that part of our hope is that viewers of these programs will learn from, but also be moved to take some action on behalf of the issues we're discussing. And to that end, Joe, I'd like to ask you a little bit about the national reform efforts, because I know that you've been very involved, as have I, on behalf of a particular approach to what national health care reform should look like in a particular piece of legislation. And we just had a very interesting meeting with Congressman Andrews about that a few days ago. And I wonder if you might talk a bit about that approach.
Yeah, the national debate boils down to 2 competing plans, in essence. You'll hear a lot of people say I don't know how to choose. You'll hear, for example, various Congress people say, I can't make a decision because there's so many bills in Congress. Well, for citizens out there, they should know that all those bills at this point in time boil down to 2 basic plans. One, Charlene has already referred to as a managed competition plan. The other is single payer folks who support a system which is administered by the federal government, which works with the states and allows the states to administer their plans and to provide everybody with coverage as a right, severing the link from employment with and health insurance, so that you as a citizen of the state of Maine would receive a health insurance card that covers you for comprehensive services, no co-pays, no deductibles, no out-of-pocket costs, and you would have the freedom to choose your provider. That's the single-payer plan. Managed competition, as we've heard about it on the national level, is, as Charlene has indicated, doesn't work in various states. We met with Senator Mitchell, and he was fairly forward with us, saying he didn't believe that managed competition would work in the state of Maine because we don't have the population base to support managed competition here in Maine. Even the primary advocates of managed competition in the New England Journal of Medicine have indicated that that it wouldn't work in rural states. That's why I and others in the group of Consumers for Affordable Health Care are so supportive of Charlene's bill and Senator McCormick's bill, because that takes the best elements of the single payer approach and the best elements of the managed competition approach and puts them into a bill so that you, the consumer, have the choice of, do you want to go with managed competition or do you want to go with an open plan? I think it's a wonderful approach to it. It preserves a private involvement in it, and it preserves a public involvement in it. And I think this is where we, the consumer, have found we see a great support for us. You know, and I know, that we don't, as consumers, individual consumers, have the bargaining power. We don't have the market power to force providers to bring down their rates, or insurance companies to bring down their rates. What this bill simply does is backs up the consumers with an agency that basically acts as our representative and says, we're going to negotiate the rates with the drug companies. We're going to negotiate the rates with those insurers that decide to play by the rules. We're going to negotiate the rates with doctors. We're going to negotiate the rates with hospitals. And we've had that lacking. You know that you can't tell a big drug company that you're not going to pay the $100 that they want, and your child needs these drugs. So what do? You don't have anybody supporting you. And with hospitals, you can't negotiate. So finally, we have somebody that's an entity that's going to come in and back us up. And it's a publicly accountable entity. So we don't like what they're doing, we can all, as a citizenry, change the way that this the course is going. I think that we fit in well with the national efforts. There is a bill called the American Health Security Act. It is presented by in the House of Representatives and Congress by Jim McDermott, in the Senate by Wellstone, Paul Wellstone of Minnesota. It has now 60 co-sponsors, and I just found out today that Tom Andrews has decided to co-sponsor the bill here in Maine.
You've heard it here first, folks. Right here on your local community access station.
That's right.
Late breaking news.
And it's a wonderful bill. It provides states like Maine with the flexibility to do this type of plan and work within federal rules. And I think it's a wonderful thing that Tom has signed on to the bill, and we congratulate him. And we look to, we look to the state level activity, because we really know that, as Senator Mitchell has said time and time again, the states are the models for what's going to happen on a national level. And I very much look forward to seeing, for example, Hillary Clinton looking at Representative Rydell and Senator McCormick's bill as a model for the rural states like Maine.
Okay, well, I think we need to talk about your bill, just to try to put this then in context for viewers, because this stuff does get very complicated. And you know, we're sitting here with some of the people who've been leaders in the state of Maine in this effort for a number of years, and it's a complex process for anyone. But I know from my experience in dealing with workers in the factories and the mills and so on that I deal with through my job as a union representative, everyone is looking forward to what this reform bill is going to be, and there is some, I think, naivete about what's going to happen on May 1st, and that my health insurance bill somehow will get settled on May 1st, and and the problems will all be resolved at that point. And I think we certainly know that May 1st or early in May there will be an important proposal from the administration, but even under the best of circumstances, it's going to be some considerable amount of time before any national reform really gets cranked up and becomes effective here at the local level. So that viewers understand where we're at, we're looking forward to a federal piece of legislation, but as we do so, there is a very active effort here in the state of Maine that on Representative Rydell and Senator McCormick's bill, and we certainly intend to work through this session of legislature to see that it's adopted. Charlene, with that, would you try to summarize for the viewers what the bill's called, what the bill does, and I think importantly for people, what would your health care system look like if your bill was to be adopted and signed by the governor? What would the health insurance system look like to citizens in the state of Maine soon thereafter?
Well, first of all, I have to agree with you that whatever happens early in May, there's not going to be an overnight change in our health care system in the United States. It would, we hope, present a model and a framework for reform, but I don't believe that we're going to have a bill with all the I's dotted and the T's crossed. I think we're more likely to have some general direction and hopefully also some small group reform and individual insurance reform that can take effect immediately. But we also hope that there will be the opportunity for states to adapt what the framework that comes out of Washington to the specific situations of their state. And that's what we have tried to do in our bill, is to make it appropriate for Maine. And I sometimes jokingly, but really seriously, call it the Modified Managed Competition Plan for the Rural State. And the reason I say that is we're trying to take advantage in this bill, which is called an Act to Provide Family Security Through Quality, Affordable Health Care. And I want to stress the family security, because I believe that we would be relieving an inordinate amount of stress in American families and families here in Maine if we could say to them, your health care expenses will be predictable over the years. Whether you are sick or well, your health care costs will be predictable. It will be a certain percentage of your income, and it will not be 2 or 3 or 5 or 10 times that if you happen to have a family member who becomes ill. We want to be able to say to businesses, yes, you will contribute, but you will not have responsibility for negotiating and managing a plan for your employees. You will be asked to pay a health assessment into what we call the Maine Health Trust Fund, and our proposal is actually quite simple. It proposes a trust fund into which businesses would pay an assessment, into which individuals would pay a premium based on their income, and that would include earned and unearned income. And we hope to have the necessary federal authorization to put the government dollars that are coming into our state and the state dollars that are already here in healthcare also into that trust fund, and to manage all of the healthcare dollars in one place. And to manage those dollars, we would establish what we call the Maine Health Agency, and that would be not another department. It would be an independent agency. We do have some models for that, where we have agencies that are linked to government but are not a government department under the governor. They are separate. They are usually they're commissioners. In this case, we're going to these will be members of the Maine Health Council that will actually be responsible for the day-to-day management of this agency. They will have terms that will span gubernatorial appointments, and we will also have a consumer advisory board. We want this agency to be responsive to the needs of our state, and that agency will be responsible not only for managing the funds in the Maine Health Trust Fund, but also for health planning and regulation and negotiating of fees, as Joe said. And also, most importantly, for entering into contracts with individual providers or with what we are calling organized delivery systems. As I mentioned, we do have 2 HMOs in our state, and we also have a couple of preferred provider organizations, PPOs, and we have some other organizations that are interested in forming PPOs. The system would require that people have a primary care provider, a primary care physician, or use a rural health center or community health center or a family planning agency as their primary care provider. And their entrance into the specialty world would be through that primary care provider. Many of us are faced today with having to find our own specialists, having to really self-diagnose. Many people in Maine do not have family doctors.
Yeah, I think many people that I know have no doctor other than the emergency room doctor that happens to be on call when they come in.
That's right.
I mean, that's their access to the system.
That's right, and that's a very expensive access. It costs a great deal more money, and frankly, it also brings into the emergency room the kinds of cases that should not be treated there, and that if there is a real emergency, are taking up the time and the expertise of physicians who should be there to serve real emergencies. So we want to change that system, and we want to give people the security of knowing what their health care costs will be and of having a family physician. We propose that individuals, while they would pay their income-based premium into the Maine Health Trust Fund, would then choose their provider. So we maintain that part of our current system which allows choice.
Mhm.
The difference is we would allow choice for everyone. Right now, we have some people who are locked out of any choice because they have no funds with which to purchase health care, and hence they show up at the emergency room and take whatever provider happens to be there. We want every person to be able to have a choice. If they like the model of an HMO and they want to work with either HMO Maine, which is a Blue Cross organization, or Health Source, which is our other HMO, that's fine. That's their choice. Their employer will not be making that choice for them. They will make that choice. If they prefer to sign up with a primary care physician who is not part of one of these organized delivery systems, that also can be their choice. We will sever the tie, as Joe said, between health care coverage and employment.
Can I just stop you there for a second, because I think this is an important point that we need to just focus on for a minute. It is true that most people who have health coverage have it through their place of employment, and that's the system that's grown up here for historical reasons that date back to the Second World War, but nonetheless, that's the system most people are familiar with. What does it mean? Why is it important, Joe? Why is it important for people to sever that link between their job and their health insurance?
Here in the state of Maine, just for an example, 85% of the businesses in Maine are small businesses. Of those 85% of businesses, as small businesses, more than between 50 and 60% do not offer health insurance coverage. And so all those people who would normally get coverage from their employer don't have coverage.
There's no requirement on the employer to offer coverage.
Right.
And which is the reason some of them don't.
Right.
But there's also the expense, and that I assume is why many of them now don't offer the coverage, right?
Many of them, I talk to a lot of small businesses. As I said previously, we have about 100 small businesses that are part of the Consumers for Affordable Health Care Coalition. When we talk to them, some say the costs are just too much.
Mm-hmm.
Some of them say that they don't need to do it in order to compete with the pizza shop down the street.
Mm-hmm.
That pizza shop don't offer it, we don't offer it.
Mm-hmm.
It's just that simple. In many rural areas, that's true.
Mm-hmm.
But when you have that staggering number of employers that are not offering health insurance coverage,
Mm-hmm.
then what's the other means for somebody to get
Mm-hmm.
coverage? Well, they have to buy it on their own.
Mm-hmm.
And it's a very scary proposition of being out there on your own trying to get health insurance coverage from an insurance
Mm-hmm.
company. They're not interested in covering you
Mm-hmm.
unless you're a very young, healthy
Mm-hmm.
person.
Mm-hmm.
I think the other thing is that just think of all the problems that it creates for not only for you as the worker, but for the business. We have, for example, up in Bangor, we have a small business that has 40, well, I should say medium-sized business, has 40 employees. And they joined the coalition because they said, if there's one thing that we'd like to see you do, is no matter how it works out that we have to pay, just get us out of the system of having to administer these plans and constantly go through the process with insurance companies year after year after year of trying to find a policy that's affordable for us, that covers all the workers, not just the healthy ones. And so it's become an incredible burden for employers to search and find these policies and to maintain them, and the costs just keep going up. So they want to see the link severed too. I think this bill is wonderful in that it does that, and it does it with the least disruption to the way that we get health care now. People are familiar with getting insurance through their place of business if it's a larger business. This system has the least disruption to that. Employers would no longer have to deal with all that paperwork, but they would pay into the fund, the healthcare trust fund. And I want to point out for your listeners that this is completely separate trust fund from the state budget. This is not money that will be attacked and jumped upon when we have less money to run state services. This is a completely separate trust fund. But I think those businesses understand the importance of being able to provide their workers with coverage and to do it at an affordable rate. This program, because it streamlines the system and provides everybody with coverage, is cheaper than the existing system. Businesses, for example, you, Mike, you know that many manufacturing businesses in the state of Maine pay anywhere from 12 to 14, 15% of their gross payroll for health insurance.
Sure.
This bill cuts that almost in half, and it's a tremendous stride forward.
Yeah.
I think this is the bill that's going to attract businesses to Maine. Businesses are going to say, if I can go to a state and set up shop and cut my health insurance costs by half or somewhat less than half, I think that they're going to say this is an attractive place to do business.
Okay.
I think there are a couple of other reasons that are important to bring out also. It may have been true in the past that many people went to work for a particular company and they stayed there full time with that company for most of their working life. Well, certainly that is no longer true. People are needing to change jobs 2, 3, several times during the course of their working life, or they need to put together perhaps 2 or 3 different jobs in order to earn a living wage. So what we have is people no longer working full-time year after year for one employer. And what has happened is the larger employers in our state have been offering good comprehensive coverage, and many of those are businesses and manufacturing firms where there have been strong labor unions, and that has been part of the
It's been negotiated in the contracts over the years, and
that's
the
right.
health plans are, generally speaking, relatively good.
Right,
And
but those employers are actually bearing a burden for many other businesses which are not paying anything. I have in my area a very large employer, and it is possible for small businesses in that area to just make sure they can hire family members of the large employer so that then they are relieved of offering coverage. We also have many businesses that more and more are hiring part-time workers,
absolutely.
seasonal workers. These people do not have coverage because they don't work enough hours for one employer. So what we need to do is to require that all employers make a contribution for every one of their employees, but not based on setting up a plan for that employee, based on putting some money into the trust fund so that if they have an employee or hundreds of employees who work on a seasonal basis at Christmas time or in the summer in our tourist industry, then they're going to be making contributions rather than escaping those contributions. By the same token, right now, if an individual does not have access to group insurance and has low wages, that person is locked out of being able to purchase a comprehensive policy because he or she can't afford it. You have to afford 100% of it or you don't get anything. And what we're saying is that's unfair. We need to ask a person to contribute a portion of his or her income and to contribute it during your entire lifetime of producing income, and so that your coverage is there when you need it. And that means that young people are going to have to contribute whenever they start working, they will be asked to contribute. It means older people who have large amounts of unearned income will be making a contribution based on that. And it will be fair to everyone. Everyone will have the same degree of coverage. It will be portable. It doesn't matter whether you move from Skowhegan to Brunswick or from Biddeford to Presque Isle. You will take the coverage with you. You will obviously have to find a new provider, but you will not have to worry about your coverage changing or what's going to happen because you had an illness in the previous year. And in addition to that, it will be comprehensive. It will cover primary care as well as hospital care. Health insurance started out as hospital insurance, really, and that was appropriate back in the days when we didn't know very much how to prevent illnesses or how to even treat illnesses at early stages, and so you needed protection from large hospital bills. But now, much of our healthcare system is aimed at preventing illnesses and at detecting and treating illnesses very early. And for many of us, even if we have comprehensive coverage, we don't have that kind of coverage. So we want to change the healthcare system and the health insurance system to be ready for the 21st century and to reflect what's really happening in the practice of healthcare.
Well, that makes a lot of sense to me, and it hopefully makes a lot of sense to our viewers. And in some respects, I'm worried that maybe it makes too much sense because we've not been that successful oftentimes in getting things accomplished that seem to be the right thing to do. And I wonder if we might take a few minutes to talk about what do we see the prospects being. It's important that we dispel some myths, and I wanted to amplify on the breaking the link between employment and insurance. I think it's important, but there are it's not necessarily smooth sailing ahead for your bill, is it? You have a number of co-sponsors, but would you say that this bill is a sure bet at this point, or will likely faces some uphill fight?
I think it will face some uphill fight. We do already have 15 co-sponsors in both the House and the Senate. We hope that we will have more by the time the bill is printed and comes to a hearing. We held an orientation session. Senator Dale McCormick and I are the two major sponsors of this bill, and we held a session for our colleagues and had quite a number of people who attended and 15 who actually signed on to the bill. However, it is clear that there will be some providers and organized provider groups that will see this as an intrusion into the independence of providers, as fees will be negotiated, and frankly, particularly for some of our super specialists, it will mean a decline in their ability to control their income. We will have more regulation with respect to the amount of technology that we use. We hope to treat illnesses early, which also means that there will be less of the high-tech kind of medicine. We intend to continue with our hospital regulation, which is still fought by some hospitals. We also have to contend with, obviously, the financing mechanisms, and some businesses will be paying more because they aren't paying anything now, but other businesses will be paying less.
Let's just stay on that point for a second, because I think it's so important. It struck me as being just patently unfair that some businesses and those unions where we're able to negotiate benefits for our members are literally carrying the burden for those who choose to take that money and not put it into their employees' health insurance needs, but to put it into their own pocket, essentially. And that's, the system allows for that. There's no requirement now that employers provide health insurance, and so it seems to me to be very putting our unionized firms, for example, just to look at it from my point of view, at a real competitive disadvantage with those firms that are able to get away essentially without paying those same insurance rates. And your bill, as I understand it, would level that playing field so that competition between firms would not be on the basis of who can provide the least amount of health benefits to their employees, or the least amount of wages, or the race to the bottom that they oftentimes engage in, but will level the playing field on that score, on the health insurance score. And is that essentially what the bill would do in terms of how it impacts upon employers?
Yes. We do intend to level that playing field and to have a fair contribution from all businesses. By the same token, as Joe said earlier, so many of our businesses are small, and the person who owns a plumbing supply shop or a small pharmacy or a grocery store or any one of thousands and thousands of small businesses across our state, they know about running their business, but they don't know about negotiating health insurance. And it's put them at a very competitive disadvantage also when they have to go out there and contact an agent and figure out how to put together a plan that's suitable for them and their employees. And we want to relieve them of all of that. We want to get their contribution to require that all of them contribute, but not that they provide insurance. And that makes our bill different from what some states are moving towards, where they call it the employer mandate bill, where employers would be mandated to provide health insurance. And Senator McCormick and I did not believe that was the direction that we wanted to go in Maine, and we worked very closely with the Consumers for Affordable Health Care and all the 75 organizations and individuals who are part of that coalition to work out what we think is a fair and equitable way to go forward in our state.
One of the other, I think, key things about this that was very appealing of this bill, which was very appealing to the small businesses in our coalition, is that it establishes a small business hardship fund and says that those small businesses that are and have not provided or have been unable to provide would be able to get a certain amount of the money in the trust fund will be set aside to help them, phase them into coverage or at least payment for this program. And I think that was really a selling point for us.
And could I just, from the point of view of somebody who's going to be out there and say, well, geez, you're talking about now me as an individual, I've got to pay into this fund, more taxes, all this. I mean, that's the sort of approach I'm sure that we're concerned with from people. And I wonder if you might, either one of you, address that just in terms of how is it that people are now paying for health insurance, and how is it that that although they would be paying a certain amount into the plan that you're describing, Charlene, where is that savings coming from?
Well, now people are paying really in the least equitable fashion. Those people who work for the largest employers pay the least because their employers have negotiated good plans, comprehensive plans, and the employer is paying most, if not all, of the cost of that plan. Whereas the person who's working for the small employer may be paying most, if not all, of his or her own costs. So two people earning the same amount of money, one working for a large employer, one for a small employer, or one just in two different parts of our state, or just two different employment situations, they're paying different amounts now. By the same token, two people with the same income, one who happens to have an illness or a family member with an illness, and the other person that has all family members healthy for the time being, again, there's an inequitable situation because the family that has the sick person is paying much, much more because they have to pay their deductibles. That's what gets left after the insurance company pays, and then there's the and usually before the insurance company even pays at all, you have a certain deductible, and then in addition to that, you have your copay. That's what you share, the amount that you share with the insurance company. And then you have your uncovered services. Many people do not have any coverage, for example, for necessary prescription drugs. I've had pediatricians lament to me that they see a child that has an infection, and ear infections are one of the very common ones, and they treat the child and they diagnose it and they hand the parent a prescription, and then they don't know whether this parent is going to have the money to go to the pharmacy and purchase that prescription that is necessary in order for that child to recover. And we want to end that. We want to have people be able to know on an annual basis. They know approximately what their income will be. They'll know what the percentage of that income will be, and they will not be hit with suddenly having to pay hundreds, if not thousands of dollars because they have an illness that they had no way of knowing would strike their family a year ago or even perhaps a month ago.
Well, let's talk for a minute. We have only a few minutes to go, but I think it's significant that this last Sunday, the Maine Sunday Telegram did a full page, the back page of the front section, a full feature on Charnene and Dale's bill and diagrams and stories. I would not normally recommend the Maine Sunday Telegram, but no. This issue, I think, is very much worthwhile because it gives a very good summary of this very complicated subject and what the bill would do. But at the top of the page, it talks about first reactions to the plan are very mixed, and it talks about the doctors saying it's worrisome, the hospital saying this is premature, the insurer saying it's unclear, and if there's anybody who knows about things being unclear, it's got to be the insurance companies, and business saying it's risky. Citizens, of course, said it's necessary. Citizens groups do think it is necessary. But I wonder if you could just talk for a couple minutes, maybe Joe, talk to us just for a minute about what you see shaping up here in terms of the fight, because this is going to be a political fight to win passage of this bill. And I wonder if you could sort of identify who you think the opposition is and how might citizens get involved in this effort.
I think it's absolutely essential that the citizens who are listening to this program get on the telephone, call their local legislator, or they can call their the state house and find out who their legislator is by calling 1-800-423-6900 for their senator, or 1-800-423-2900 for their representative, and get their representative and senators to be a co-sponsor of Charnene Rydell and Dale McCormick's bill, which is called An Act to Provide Family Security Through Quality Affordable Health Care. That's absolutely step one. With regards to the fight as it's shaping up, I think you can look at any of those groups that you just named, and I think there's going to be a split within every one of those powerful organizations that they're going to have to decide, is this the way we want to go? And I think that you're going to see a lot of hospitals, a lot of doctors, a lot of businesses getting onto this bill.
Okay, well, great. Thank you. Charnene Rydell, Joe Ditre, thanks very much. We've been talking about the state reform effort and our efforts to support the bill, An Act to Provide Family Security Through Quality Affordable Health Care. Hope that you'll take advantage of this opportunity to call your legislator and get involved in the fight for affordable health care for the citizens of the state of Maine. Thanks very much, and
Thank you, Mike.
good evening.
Thank you.
Yeah. Okay. And
Well,
yes,
that
we're done.